everyone. Thank you so much for being here today. We're going to go ahead and get started because we do have a lot to cover. Thank you for joining us for this training on serving older adults. Today, we are very, very lucky to have Susan Frazier from the Jewish Family Services of Silicon Valley and Sherry Burns, Executive Director from the Silicon Valley Independent Living Center, to provide us with this really important training. So just to start off, I'll go ahead and introduce myself. My name is Carla Carvalho, and I'm a policy analyst at Homebase. And for any of you that maybe don't know about Homebase or what we do, Homebase is a nonprofit technical assistance provider, and we provide technical assistance for COCs all across the nation. And we work really closely with the Office of Supportive Housing in Santa Clara County. And one of the things we do for the Office of Supportive Housing is we put together these trainings for you all. This training is part of what we hope to be an annual training calendar that we have created for you all. We're constantly looking to improve our trainings. So later in the training, I'm going to be popping a feedback form specific to this training in the chat. It's really, really helpful if you all take a couple minutes to fill it out, because we really want to continue improving our trainings and tailoring the trainings that we bring to you all to make sure that it's actually supporting you in your work. So look out for that link, and I'll mention it again at the end. So I'm going to go ahead and advance our slides here. So just some Zoom things. I know folks are very familiar with Zoom by now, but I do want to let you know that we are recording this training because, as always with the COC trainings, all the training materials, including the recording of this training, as well as the slide deck that Susan and Sherry are going to use to present to you all today, that will all be posted on the COC website. And it's also going to be sent directly to you all if you registered for this training, so you can have it to reference. So don't worry about having to screenshot slides, or if you missed anything that was on a slide, or any of the resources that Susan and Sherry will share, it will all be provided to you after the training. We are going to keep everyone on mute by default, but there will be time for questions at the end of Susan and Sherry's respective sections. And then I'm sure we can do questions at the end as well, provided that we have time. In the meantime, please utilize the chat function to pop in your questions, and we'll try to kind of take a look at them throughout the training as time permits. And then, as always, any questions that go unanswered, I'm happy to be sort of the person that follows up with Susan and Sherry to get responses to you all and send it out as a follow-up. If you do happen to get kicked out of the Zoom, please send me an email at carla at homebaseccc.org. I'm going to be monitoring that throughout the training. And then if you're having any issues while you're in here, just go ahead and direct message me in the chat. I also want to say that closed caption is available. So if you hit closed captioning, you should be able to enable that feature if that's helpful to you. So just a quick icebreaker to get folks warmed up in the chat. If you would go ahead and write your name, your organization, and then what color describes you. So now I'm going to stop sharing my screen while folks are typing in the chat. And I'm going to go ahead and share Susan and Sherry's PowerPoint and pass it on to them. So let's get that pulled up. All right, great. Susan and Sherry, please feel free to kick us off.
Great. Well, it is, can you see me? Can you hear me, Carla? Yeah, we're good. It is really great to be here. Sherry and I did this training last year, and I think it looks like we've maybe doubled the number of people who are training or who are attending this training, which is so fantastic because it just says a lot to about the awareness that people are developing regarding older adults. And so I'm really appreciative that you're here. Come on this journey with us, and hopefully when you're done, you will feel like you have more awareness of older adults, your sensitivity towards them, and also how to work with them. My name is Susan Fraser. I'm the CEO of Jewish Family Services of Silicon Valley. I have spent the better part of 35 plus years working in the nonprofit world, in specifically working with older adults. And lots of that has been in Santa Clara County. And now I'm at Jewish Family Services, where we're not only working with older adults, but we're also resettling refugees from Afghanistan and Ukraine. We're providing counseling for adults and families. And we're also providing a lot of support services to older adults, including Holocaust survivors. And you might be surprised to know that there are still about 275 Holocaust survivors living in Santa Clara County, and we are supporting those folks. So you can go ahead to the next slide, Carla. So let's get on talking about aging and what that means for us and what it means for our community. So there's one thing that we are all doing right now, which is we are all growing older. At the end of this presentation, you will have grown older. And honestly, most of us are scared to death of that possibility. That's why it's so great that you're here, because a lot of people just don't even want to talk about it. We want to grow older, but we're also really afraid of it. And the irony is that the more that is more and more of us are living the same experience together, we're all getting older together. In fact, we've done such a good job of doing that, that people over the age of 65 will outnumber the number of children under the age of 18 in only 12 years. So let's just let that sit for a moment. There will be more people over the age of 65 than under 18 in probably less than 12 years. So think of how we have built our communities. We've built them with children and young families in mind. And how about our public and social services system? Now, it's not a bad thing that we address the needs of young people and families, but with these transformational demographics, it is imperative that we really start looking at developing communities and services for all ages, older adults, adults, and children. If we continue to deny that our world is aging, then how will our policymakers plan for you, for me, and our children? How will they plan for us all to access healthcare, access housing, transportation, and other essential services when we need them? Next slide. What's even more fascinating to me as somebody who's worked in this field is that the life expectancy in California is now 81.9 years. And you can be really proud to know that California has the longest life expectancy in the nation. We're healthy here. But 81.9 years is actually down from 82 years because of the many COVID deaths. And while it's important to note that there are clear ethnic, race, and gender disparities, we will likely see that equity gap return for the better as we recover from COVID, which brought life expectancy down for Blacks, Latinos, and Asian Pacific Islanders. And what's really astonishing is that those who are over the age of 85 are the fastest growing age group in our state. And I'm going to venture to say it's probably the country as well. So those over the age of 85 are the fastest growing age group in our state. Next slide. We can also see that California's older adult population is becoming more diverse. Its majority is still white, but it is becoming more diverse. What's important to note is that different cultures have different ideas of aging. They have different norms. They have different ways of supporting older adults, which in the long term could be very, very, very beneficial for our service and housing systems, particularly for those cultures who value older adults living with them in their own homes until the end. There is an unfortunate reality that the longer we live, the higher the chances we have of living alone or living in poverty as we outlive our partners, our savings, and depend on Social Security alone to make ends meet. But the days of living one's retirement in a rocking chair, you'll be happy to know, are far gone. Older adults are far more active than they've ever been in society, and in ways that are really irreplaceable. So whether it's in the work environment, whether it's volunteering or supporting our working families. And what's really great is that the fitness classes in senior centers are the most popular programs that senior centers are running right now. Older adults want to be fit and healthy. And so the days of thinking about senior centers being focused around bingo are gone. Those bingo is not the centerpiece anymore. Next slide. So let's talk a little bit about ageism. What is it? So often when people think of old, they think of really depressing things, like they think of being placed into a nursing home, they think about developing dementia, or they think of dying. And so why are so many people afraid of these things, that these things will happen to them? Why are we so afraid? How did these fears even become so prevalent? Well, it's called ageism. Ageism means that we create stereotypes or discrimination on assumptions about someone's age. And why are we thinking that old people end up in nursing homes when the reality is that only 4% of people over the age of 5 are living in them? Yet we are so afraid of that. And how about dementia? The reality is that most of us will think just fine to the end of our lives. And yes, more people are living past 85, which means that more people will develop dementia, but the rates themselves aren't growing. There just are more people in the world. So every time someone makes an assumption about what we're capable of based on how old we are, without finding out who we are, that's stereotyping us. And it goes both ways. We do that to younger people too. All isms are socially constructed ideas and include racism, sexism, homophobia, so on and so forth. All of these prejudices pit us against one another. We know it's not okay to allocate resources by race or sex. So why is it okay to weigh the needs of the young against the old? Don't we all matter regardless of age? Next slide. So why does ageism matter? Well, when we are too embarrassed to be called older, we're really denying ourselves the opportunity to celebrate that we are moving through life. When we lump all older adults together, we miss the opportunity to explore how different we really are. Think about the adults from ages 60 to 100. That's a 40-year span. In no way are we all the same. That's equivalent to us saying that 15-year-olds and 40-year-olds are the same. Or that's like us saying that millennials are all entitled. If you work directly with clients, Do you consider all older adults to be the same, regardless of whether they are 60 or 80? Good question to ask yourself. The world that 60-year-olds grew up is far different than the world that 80-year-olds grew up in. The values are different, the experiences are different, the perspectives are different, and even the music is different. The 60-year-olds may be listening to Fleetwood Mac, while the 90-year-olds are listening to Elvis Presley. And the social inequities grow even larger when we couple ageism with racism and sexism or homophobia. So what chances, just think about this, like what chances do Black queer women have of being considered valuable contributors in our society? And what's really interesting also is think about that the fact that older adults can be ageist too. When arthritis makes it hard to open a jar, we blame ourselves as incompetent. If you see an older adult struggling with that, they're going to think of themselves as incompetent. That's ageist. When it gets hard to see while we're driving at night, we feel shame. And instead of acknowledging that aging is a natural journey, we feel badly about ourselves. And the question that we have to ask ourselves is, who benefits from aging? Who would like me to start coloring my hair? Who keeps telling us that wrinkles are bad? The multi-million-dollar cosmetic industry really likes us to stay looking young. And the multi-billion-dollar pharmaceutical industry would love for us to take supplements to make our memories and ligaments stronger. And during the height of COVID, I did what a lot of women did. And I transitioned from coloring my hair to letting my hair be natural, as you can see. And as somebody who has worked in the field of aging, who has tried really hard not to be ageist, I can't even begin to tell you all of the anxieties that I went through just to make this decision. I questioned if the world would suddenly treat me differently, if I'd be less respected in the workforce, if I'd no longer be attractive. I mean, that's crazy. And get this, research is now showing that how we feel about aging has a direct impact on our bodies. Those who have positive attitudes towards aging are actually living 7.5 years longer than those whose self-esteem and dignity are caught up in ageist beliefs, particularly those who believe that they have lost their self-worth in this world because they are older. For those of you who have DEI initiatives in your organizations, remember, and please keep bringing this to the table, that age is a diversity too. And ageism will oppress all of us if we don't address it. So I encourage you to do so in your organizations. Next slide. So let's talk about some of those things that people say to contribute to our negative attitudes towards older adults. So people will say, "She's so cute. He's surprisingly sharp. Isn't it time that she retires? He's doing so well for 85. Old people can't change. Old dogs can't learn new tricks. Of course he's depressed. He's old. Of course she has dementia. She's old." All of those statements are either very patronizing or presumptuous. And so when you hear those statements, I want you to think of yourself as though those statements are being made toward you. Next slide. And here are some stereotypes that older adults are often getting lumped into. Again, are some older adults rigid? Yes. But so are some 30-year-olds. Are some older adults unable to cope? Yes. But so are some 40-year-olds. Are some older adults lonely? Yes. So are some 18-year-olds. Next slide. Now, what we really need to consider when we think of ageism is that those older adults, is actually us. So when we create stereotypes and prejudices against others based on age, we are actually impacting our futures. Are the stereotypes that we create for older adults how we want our older adult years to look? You have to question that. Ageism feeds our denial that it will be us. It will be us. We need to reframe this. It's not them that we are talking about. It's us. Carla, you can start the video.
Okay, awesome. And folks, let me know if you can hear it. Folks hear it.
What do
I think we lost the sound, Carla.
The sound just stopped, yes.
shared experience? But the way we talk about it can diminish and harm older people, even when we don't mean to. It's phrases that casually equate being older with being less valuable. It's imagery that too often portrays older people as needy or isolated. There's a better way to communicate about aging. We can stop othering older people by talking about us instead of them. A them statement segregates and blames. For example, older adults are a challenge for our healthcare system. They make a lot of demands on a system that is not prepared to care for them. An us statement is inclusive and helps all of us see ourselves in the issue and in the solution. For example, we need a healthcare system that is built to help all of us live well as we age. When choosing photos, images of diverse older people interacting with others send a more inclusive message. When we shift from them to us, we promote a more realistic, inclusive view of aging, reduce bias, and build support for policies and programs that can help all of us at every age. The Reframing Aging Initiative provides free evidence-based tools to help us get there. Learn more at reframingaging.org.
You can go to the next slide, Carla. Almost there. There we go. So one of my biggest pet peeves is when I hear people call older adults honey. You know, we often hear people talk to older adults as though they are children again. And in no way are older adults like children. They have led lives that are full, that have represented a myriad of experiences that no child could possibly have ever had. For those of you who work directly with older adults, I challenge you to learn more about who they are. She isn't just an 80-year-old. She was once 20, 30, 40. All of those years make up the person that she is now. She was the same age that you are now. What was important to her when she was 35? What influenced those years for her? there are things that we can do to make some cultural shifts away from ageism. And one of the easiest ways that we can create change is to think about the words that we choose and the language that we choose to use. So very often, how people talk to older adults is patronizing, as though they are children. So let's look at some examples. So the ageist way is saying they or them. When talking about generations, we can talk about we or us. Inappropriately addressing people with terms of endearment like honey, instead calling someone by their preferred name, to show respect for them regardless of age. And young at heart implies that being young is good, but being old is bad. So instead, we can give thoughtful compliments based on the person, not on their age. And speaking to an adult of a different age with a childish language, I hear that a lot. People speak to them with a tone as though that they are children. We want to talk to older adults as though they're our peers and they're equal to us regardless of their age. Next slide. So let's test your knowledge a bit. The fact of the matter is that we are all ages. We may try not to be, but we are. So we need to check ourselves and what we really know about aging. So first question is, where's my question? There we go. The first question is forgetfulness. So Carla, are you having people put in their own answers on this? Yeah, okay. You guys get to respond. So true or false? People experience age-related forgetfulness beginning in midlife. Oh, it's almost a tie. It's neck and neck here. So the answer is false. A name might escape you, or you stand in the middle of a kitchen, but temporarily, you're unable to remember why did I come in here? And people over the age of 85 may say, oh, well, that's just having a senior moment. But let's just remember that, we all lose things. I still lose things all the time. And I did when I was a youngster. And so that doesn't necessarily have anything to do with the fact that I'm over the age of 50. And you're more likely to forget information when you're fast-paced, you got a lot going on, you're disorganized, but that doesn't have to do with aging. Next slide. So I love this one. Personality. So true or false? Personality changes with age. You guys vote. Looks like the majority of you have that as false, but actually the answer is true and false. There's a trick question, sorry. Life experiences and brain development provide most of us with emotional stability, conscientiousness, and agreeableness as we age, which are all really great assets. But we have a different perspective on what's important when we're older and what battles we need to fight. So as a whole, our core personalities pretty much stay the same. So if you were an extrovert at 16, you'll probably be an extrovert at 65. But if we assume that personalities will just remain stagnant, then we feed an erroneous concept that we never grow or change as we age, and we do. You know, I've grown in the last 10 years or more. I have more growing to do. Next slide. So let's check your knowledge about the senses. So true or false, all 5 senses tend to decline with age. True or false on that? So you guys are right on with that. The answer is it's true. So for the most part, even though it varies from person to person, there is a decline in the senses: vision, hearing, taste, smell, touch. All those do tend to decline as we age. Next slide. So true or false, older adults are less anxious about death than our younger and middle-aged adults. Older adults are less anxious about death than our younger and middle-aged adults. True or false? False. It's actually true. So this is why I ask these questions, because they're tricky, aren't they? The question really is about who is having the anxiety about death. We have this picture in our heads of older adults being depressed because they're going to die soon. But for most people, as they age, they have some sense of completion, and death is no longer a stranger to them. And they, as they've often outlived many of their friends and family. And as it turns out, the longer that people live, the less fear they have of dying. Next slide. So, what's the biggest component to aging well? Multiple choice question here. Is it exercise? Is it having a good retirement income? Is it not smoking or drinking? Is it having a strong social network? What do you think is the biggest component to someone aging well? You guys are right on with this. So yes, it's the social network. We really saw this play out during COVID, and you probably saw it too. I think that opened a lot of our eyes that isolation has been absolutely awful, with awful detrimental effects for many older adults. Many older adults have had to sever their social networks during COVID. And those who could cross the digital divide have been really saved by their ability to connect with social media. But those who can't connect to social media have been so extremely isolated during COVID. And we have seen isolation. The research is really clear now that isolation will lead to increased cognitive decline, depression, and health problems. But you know, we're hopeful that as we move ourselves out of this pandemic, that older adults can then really start again rebuilding their social networks as COVID wanes. And interesting fact here, social isolation has been determined to be so detrimental that it's been compared to smoking 15 cigarettes a day. So social isolation is equivalent to smoking 15 cigarettes a day. That's a really important thing to think about when you're working with clients who are isolated, and understanding what the impact of that isolation really is for them. Next slide. So True or false? Older people are happier than younger people. Older people are happier than younger people. It looks like the trues are winning the race on this one right now, and you're right. So happiness in the life cycle has been characterized in a U shape. That we're happiest at both ends of our lives. We're happiest in the beginning and we're happiest at the end. And so I'll say for you middle agers, you are likely in the most unhappy time of your life because you were at the bottom of the U, but just take comfort in knowing that it'll likely get better. Slide number 23, vision. Next, there we go. So vision loss, let's just talk about that for a minute because it is so impactful for older adults when they're losing their vision. Remember, we said that was one of the senses that they lose. For most of us in this training, we're in the service industry. And so we're more likely to come into contact with older adults who are facing challenges related to aging. And those challenges will require additional support. So let's just talk about those five senses, and what we can do to accommodate those needs when you work with them. So the first is vision loss, and it's the inability to see objects clearly. And there are things that we can do to accommodate those losses, and Sherry might talk about that a little bit more later. But when an older adult has a decreased ability to perceive depth, what's really helpful is ensuring that they have proper lighting, that they have bright light, so that they can see the context of what they're looking at. And there are particular colors that are oftentimes really difficult for older adults, and those are those in the blue and violet and orange range. And so when you think about whatever literature you're going to share with them, keep that in mind when you look at the font and the color of the font. Okay, next slide. So these are some other things that are really easy for us to implement when we're working with older adults. So you want to avoid glare. Close the blinds, right? You want more light on signs. So if you have signs in your building or wherever it is that you're serving these older adults, make sure that they're well lit. Use large print for your handouts. I see so often I see print going out in like a 12 font. Well, 12 font is oftentimes too small for some older adults who have vision problems. So increasing the font will help. Using a yellow background with red print is oftentimes easier for older adults to see. And then there's the use of accessible technology features for low vision folks. And Sherry can talk about that more when she talks, because that's really right up her alley. So let's move on to the next slide and talk about hearing loss. It can be really embarrassing for older adults who can't hear well, or misinterpret what they hear. And missing information because it wasn't heard will oftentimes get mislabeled as having a cognitive deficit. We think that because they're not responding as we think they should respond, that it's because they have a cognition problem, when the reality is that they may not have heard what we said. We make assumptions that they heard the information but didn't remember it, when in fact they didn't hear the information in its entirety. Because they have a hearing deficit. And the inability to fully engage in conversation and to not be able to follow the conversation can often get older adults, cause older adults to withdraw, because the communication becomes so difficult, and it's frustrating. That creates a whole other slew of problems, because now we're starting to talk about isolation again, right? But with patience and acknowledgement from us that there is a hearing loss, we can help to mitigate some of those challenges. So there's some really great devices to help with communicating with older adults who have hearing deficits. And again, I think Sherry's going to talk about that. Next slide, we'll talk about dexterity. So, oh, go ahead to dexterity, Carla. There we go. Have you ever watched an older adult struggle to swipe their ATM card in the grocery store or take a coin out of their wallet? I just want you to imagine for a moment that if you lose your feeling in your fingertips, how difficult that would be, right? How do you feel the coin? How do you feel the card that you're putting into the swipe and the grocery store? So a little patience really goes a long way in working with older adults who may have dexterity challenges. If you're signing documents with a client, or you're having a client fill out particular paperwork, you might want to consider having a pencil grip, to help making that gripping easier. Let's see. And then let's go to the next slide, Carla. Yeah, let's go to cognitive impairment. So, as I said earlier, most older adults have no cognitive impairments, but you may be working with individuals who do, just because of the line of work that you're in. Communication is often really the key to engaging somebody who may have dementia, whether it be earlier forms of dementia or more exacerbated forms of dementia. But being positive with them, treating them with dignity, and being succinct are really crucial. So vague statements or long instructions will most likely get lost. They can't hold it. So when you're working with an older adult who has some cognitive impairment issues, it's so imperative that you keep it simple. And most importantly, that you treat them with respect and not as children. Remember, they've had full lives. They are not children. So treating them with respect is just paramount. Next slide. When you are working with somebody who has some cognitive impairments, we can't assume that if we've seen them at another visit, they're going to remember us. And so we want to provide them with that dignity, and we don't want them to feel badly about themselves that they can't remember us. So we want to make sure that we reintroduce ourselves. We want to make sure that we're calling the individual by name. We're talking succinctly. We're speaking slowly and distinctly. So if you're speaking quickly, they're not going to grab it and they're not going to hold it. And it may take them longer to process the question that you have for them. It doesn't mean they can't respond, but it's going to take them a little longer to process it. So really being patient and allowing yourself to be comfortable in that quiet space when they're processing is really important. So give them time to be able to respond. And then if you have to repeat questions, then repeat them. That's okay. Next slide. So as Albert Einstein said, we don't mind if we don't mind it, aging doesn't matter. So, if we're going to age well in a country in a world that was meant for us, we're going to remember that it's for us. It's not for them. It's about us. It's not just about them. And that aging isn't something that we really need to avoid. So with that, I am going to have Carla play the video. Downloading. If we, Carla, if it's going to take a while to download, we can always have Sherry start and we can play it later.
I didn't continue the slides.
So, shall we have Sherry step up now? Okay. So let me introduce you to Sherry Burns, who is the Executive Director at Silicon Valley Council of Nonprofits.
Thank you, Susan. That was so awesome. I love all the slides and the Q&A. Learn something all the time. And so the next section that we're going to cover is how do we best support older adults and persons with disabilities. Give a little bit more background about myself. My name's Sherry Burns, the Executive Director of Silicon Valley Independent Living Center, and we serve people with disabilities of all ages and all types of disabilities and all backgrounds who live or work in Santa Clara County. We are a peer-based organization, so most of the staff and board of directors identify as having a disability. I've been working in the independent living sector for over 35 years, both in Santa Clara County and in Alameda County. And I'll just describe myself if anybody's on the phone. I am an older white woman with short brown hair, and today I'm wearing a gray sweater. So, yeah, getting right into how do we support people with older adults and people with disabilities. Next slide, please, Carla. So, start with asking what matters to you. Don't assume we know what matters to other people, regardless of age. We all talk about person-centered planning, but person-centered planning actually starts with person-centered interaction with the individual. What is important to that individual, not what we think they might need. This includes changing the way we think, talk, and act, and that will change our attitudes about aging and advance policies and programs that support all of us at every age and stage of life. Susan talked a lot about ageism and what that is and how does that manifest itself in our everyday conversations and thoughts about all of us as we age and working with older adults. Well, there's also ableism too. And ableism is the prejudice that we often have, in that thinking that people without disabilities are better off and are more valuable. And this can also manifest itself in believing that people with disabilities have less value and less worth. Also assuming that they want to be healed or can overcome their disability. Suggesting that they're inspirational for just handling everyday activities and routine tasks in their life. Assuming that the person leads an unhappy life or limited life, and assuming that they can't do things for themselves, which are just not true. And instead of choice, planning, and control, and other individual determinants of aging outcomes, emphasize how to improve social context. For example, let's find creative solutions to ensure we can all thrive as we age. Instead of using terms such as tidal wave or senior tsunami or wheelchair bound and similarly catastrophic terms for the growing population of older people and persons with disabilities, try talking affirmatively about changing demographics. As Americans live longer and healthier lives, we need to be more thoughtful in developing fully accessible and integrated communities for everyone to participate in. Next slide, please. So what matters to you, what's important to you are very similar questions to start with as we're interacting with the individual. You don't know what's important or what matters to them. We shouldn't be making assumptions. I love this slide. What do they think? What do you think they want? Well, how about starting with asking them what they want? Some guiding questions might include, what's important to you today? What brings you joy? What makes you happy? What do you worry about? What are some goals you hope to achieve in the next 6 months or before your next birthday? What would make tomorrow a really great day for you? And what else would you like me to know about you? And how do you learn best? We all have different learning styles, so it's important to find out what's the best way for each individual that we're working with as a service provider to know how they learn. Is it by listening? Is it by reading or looking at things? Is it by actually doing the activity? What works best for them? Next slide, please. Again, part of what matters is identifying a specific, actionable, and reliable manner that can health outcome goals that can guide the decision making. It's important to realize that everybody has different things that they're interested in. Maybe the person that you're working with really likes to spend a lot of time babysitting a grandchild, or they're really into gardening, or they love to go out to lunch with friends, or they're into skydiving or kayaking, or they like reading or needlepoint. So again, asking what matters to them is essential. And then also making sure you incorporate identity and cultural awareness in your interviewing and planning. Make sure that you check your assumptions and biases. What is the individual's preferred language and cultural identity? How do they prefer to be addressed? First name, title, and surname? Consider how gender or gender identity might affect their decision making. What are their cultural or religious beliefs? What are their health beliefs? Who do they want or not want to be involved in their decision making? And is there a history of trauma, including refugee status, a survivor of violence, genocide, or torture? Remember, Susan talked about that Jewish Family Services serves a lot of folks that are still Holocaust survivors. There's generational and there's long-term effects of those kinds of trauma. And then always make sure that you're reassuring them of confidentiality. Next slide, please. So we're going to talk about the resources available to support what matters to our aging population, which includes all of us, as we just learned. Next slide, please. I'm going to cover 4 main areas to consider for activities and resources: health and wellness, social engagement, which we all learned is the most important aspect of and factor in determining someone's longevity, mobility, and equipment and assistive devices or ability tools. Next slide, please. Under health and wellness, the first area is in-home supported services. And hopefully you've all heard of some of these. Medi-Cal programs, but this is the main Medi-Cal program that provides attendant care or caregiver services to help people with disabilities, including older adults, with their personal care, cleaning, errands, and meals. And again, it's called in-home supported services, or as a lot of people refer to it, and it's acronym of IHSS. And it is essentially designed to help lower income people with disabilities of all ages stay safely in their homes if they wish to do so, with having the supports and services that they need in order to remain safely in their own home and avoid institutionalization, like in a nursing home or group care facility. Some of the kinds of things that an IHSS caregiver can provide for an individual in their home is assistance with their activities of daily living. Those could include bathing and grooming activities, dressing, feeding, toileting. Also, home care activities such as a meal preparation, grocery shopping, laundry and cleaning, and then paramedical services. And that typically comes with a prescription, either from a therapist or from a doctor, for range of motion assistance activities or medication administration and injections. The Social Services Agency for Santa Clara County facilitates and manages the IHSS program because it is a Medi-Cal funded program. And that's where people need to start in order to apply for in-home supported services. And the URL and phone number on the slide, which you'll also have later. Next slide, please. For folks that may not qualify for in-home supported services because it is a means tested program, so if somebody has an income that doesn't qualify them for Medi-Cal, but they need caregiver, again, in order to remain safely and fairly independently in their own home, they may hire a private pay caregiver. And these are typically our home health agencies that run caregiver services. So there's a list of a couple of them here. There's also a veterans program. There's Susan's organization, Jewish Family Services, the Institute on Aging, and SVILC also has a small a private caregiver list that we provide to people through our Quick Match program, and which is an online service. So there's a lot of different options that people can utilize in the community in order to locate a caregiver to provide them with any of the services that I mentioned before: activities of daily living, home making services, paramedical services, and the like. Next slide, please. Also under health and wellness are various Medi-Cal waiver services. And the first one here is the Multi-Purpose Senior Service Program, or also referred to as MSSP. And this provides home and community-based services to eligible individuals who are 65 years or older and have a disability, as again, an alternative to nursing facility placement. So the services can include case management, linkages to other needed services in the community, maybe funding or purchasing some other needed services or equipment for the person to remain in their home. And this service, the MSSP program in Santa Clara County, is operated by our area agency on aging, which is SourceWise, and the contact information is there. Next slide, please. Another Medi-Cal waiver service that's an option for people over age 55 who are eligible for Medi-Cal and Medicare combined might qualify for placement in the Program of All-Inclusive Care for the Elderly, or PACE program. And again, this is another program to keep people living in their homes or in a community-based living situation and outside of an institutional environment. The PACE program provides coverage for all needed preventative, primary, acute, and long-term care services. And those could include access to prescription drugs, their primary care physician and other medical care and therapies, transportation, checkups, hospital visits, and all of that, those kinds of services. As far as the PACE program that serves Santa Clara County, it is called Unlock, and there's the URL for more information about Unlock serving Santa Clara County residents under this Medi-Cal waiver program. Next slide, please. Then we also have CBAS, the Community-Based Adult Services Program, which is a daytime health program that is available for adults with disabilities, which could include older adults with a disabling condition. This is not a live-in program. This is not a housing-based program. So wherever the person lives, they could participate in daytime services that support them for their quality of life. And this could include professional nursing services, occupational, physical, and speech therapies, mental health services, personal care, hot meals, nutritional counseling, and transportation back and forth to the facility. So this is a very well-rounded combination of social as well as health and well-being services for the person to have during the day. And maybe they go once a week, they could go 3 times a week, just depends upon the availability for openings as well as the individual's needs and desires. And that's the CBAS program. And the next one, I think, is our last. Okay, I didn't have the adult daycare, but there is also adult daycare services, which is similar to CBAS, but is more in the social engagement component of it. And these are programs that provide social activities and a little bit of exercise and those kinds of things in a nice setting with other individuals. So there's a lot of interactive classes and workshops and activities for the person to engage in, again, during the day. Now this slide has to do with the Medi-Cal managed care plans. We have 2 managed care plans that serve individuals who are Medi-Cal beneficiaries. And those are Santa Clara Family Health Plan, which is the largest one in our area, and then Anthem Blue Cross is the second Medi-Cal managed care plan. As you can see, there's a whole host of services that are available through managed care. We have speech therapy, pediatric services, radiology, hospital stays, emergency services, dental, chiropractic care, maternity transportation to medical appointments. All of these kinds of services are potentially available to individuals who are enrolled in a managed care plan as a Medi-Cal beneficiary. One of the services listed up here is called CalAIM, and I'm going to go into a little bit more detail about the CalAIM service because that is a fairly new one that just rolled out in the past year. Next slide, please. So CalAIM stands for California Advancing and Innovating Medi-Cal. And there are 2 main components. Well, actually, there are several components, but 2 main components of the CalAIM program, and that's community supports and enhanced case management services. California Advancing and Innovating Medi-Cal, it's a long-term commitment to transform and strengthen Medi-Cal, offering 14 million Californians a more equitable, coordinated, and person-centered approach to maximizing their physical, behavioral, developmental, dental, and long-term care needs throughout their lives from birth to a dignified end of life. In Santa Clara County, CalAIM is implemented through 2 managed care plans. So I mentioned Santa Clara Family Health Plan and Anthem Blue Cross. The many services available include community supports and enhanced case management, along with other expanded services such as new dental benefits, behavioral health, and children or family support. The Department of Healthcare Services defines community supports as medically appropriate and cost-effective substitutes or settings for more costly state-paid healthcare services. Community supports are not Medi-Cal benefits, but supplemental services paid by the plans that focus on addressing combined medical and social determinants of health in order to avoid higher levels of care. They're typically delivered by a provider in the community under contract with the plans and in a different setting than traditional Medi-Cal benefits. And you can see the different kinds of services that are listed under the community supports. Housing transition navigation services, the housing deposits, nursing facility transition or diversion to assisted living facilities, community transition services, that is moving people from nursing facilities into a home-based or home community-based setting of their choice, medically supported food and meals or medically tailored meals, and then housing, tenancy, and sustainability services. So these are all brand new that just rolled out about a year ago. Now under the enhanced case management, that is a new Medi-Cal, so it's a Medi-Cal funded benefit that provides extra services at no cost to Medi-Cal members who qualify under one of the ECM populations of focus. The lead care manager and the provider oversee the delivery of these enhanced case management services, and they can help the members do such things as enroll in these services, find doctors and schedule appointments, better understand their prescription drugs, set up transportation to doctor visits, and receive follow-up services after a member leaves the hospital. And again, these are all available through the managed care plans in our area. And if you go to their websites, you will see the list of services that are available to their beneficiaries. Next slide, please. Okay, so rightfully so, Susan spent a lot of time talking about in social engagement and how reducing isolation and maintaining the social connections with friends and family and community are so important to living, a healthy and long life that person wants to be able to achieve. And our different city parks and rec services have various programs that support adults over the age of 50. And you will see that like San Jose City has health and fitness classes. They have dance classes from ballroom dancing to, Latin dances, all kinds of courses, tap dancing, arts and crafts, enrichment and education. They have music and theater arts, and then various workshops that agencies such as my agency provide to residents during their lunch meals. And those could include a class on how to hire and manage a caregiver, or could include a class on various adaptive equipment that's available to folks to increase their independence. There's also a therapeutic recreation service department under the city of San Jose, and these programs, sports, wellness, and inclusion activities, are more designed for younger adults with disabilities, but could be people with disabilities of all ages. And then each of the cities, as I mentioned, Santa Clara, Sunnyvale, Campbell, Morgan Hill, they have their own parks and recreation neighborhood service programs that are very similar to these kinds of classes that offer social engagement. Next slide, please. Another program that could be available to, again, folks over the age of 50 is the Health to You, or H2U program. And both Good Samaritan Hospital as well as Heart of the Valley Services for Seniors are part of this program, and they offer activities and events to help people, again, get out in the community, meet new friends, exercise, or try something new. It could be a day outing to a theater event and a lunch. It could be a day outing to Filoli Gardens. All kinds of different activities are available through the Health to You program. Oh, here's where I talked about the adult daycare programs. So these are coordinated programs of professional and compassionate services for adults in a community-based group setting. And again, it's more socially based as opposed to the day health care programs. And of course, the Institute on Aging during the pandemic wonderfully expanded their 24-hour toll-free friendship line to residents throughout the whole state. It was something that was more locally available here, but is available to, it's an 800 number available to anyone who is age 60 and older and adults living with disabilities to have crisis and emotional support to talk to somebody. So there's the friendship line there. Next slide, please. And then our next category has to do with mobility, is getting around. Again, part of combating isolation is helping people bridge the gap of being less mobile. And one of the ways for folks to be able to do that is to have options for them to get around in the community and get to places. There are private transport services, and many of the CBAS programs that I mentioned, the adult day health programs, they provide their own transportation back and forth to their programs, which is wonderful. But that's limited to those particular services. So we do have a couple of different options for people to get around. If they're able to use public transit, we have a very well integrated bus service with light rail, Caltrain, and Samtrans and BART in the Greater Bay Area. And those are options for people to use. But if they cannot use public transportation because they can't get to a bus stop, it's just too far away for them, they don't have the ability to be that mobile, they might need door-to-door services. And that is our accessible, basically private transportation that VTA provides, and that's called VTA Access. And those are a combination of taxis as well as minibuses that will pick up individuals at their home and take them to work or take them to, shopping, a lunch date, church services, whatever it is that they want to book a ride for. And it's paid. You do have to pay for it, but it's supplemented. So it's at a lower cost for people to be able to use that versus a private taxi. Some communities do have free community shuttle services available to residents to get around, like maybe a small community could be going to different senior housing complexes, and then to, again, shopping centers, things like that. And then there's the RIDE program that was started a few years back that covers Saratoga, Campbell, Los Gatos, Cupertino, Montecito, and Morgan Hill areas. And that is primarily volunteers that will pick up individuals, again, pre-scheduled rides to go to different places that they need to go to. So those are some community mobility options for folks. And then the senior mobility guide with the URL there gives you all of the list and goes into a lot more detail about the mobility and transportation options that are available. Next slide, please. And then lastly, I want to cover free and low-cost durable medical equipment and assistive technology devices. So as Susan was talking about earlier, is that a lot of times, all of us at times in our lives, we need to have tools to help us do things, you know. And sometimes it just has to do with, for me, I'm short, so I can't reach things on a high shelf. So I might use a reacher or a grabber to get something that's on a upper shelf. So people with disabilities and older adults might need to use different types of adaptive tools or equipment in order to maintain or increase their ability to be as independent as they would like to be. So that could include things like wheelchairs and walkers, shower chairs for safety in the shower or bathtub, transfer lifts to get in and out of bed and into another seated place. And so the Able People Foundation actually is hooking up in our area with NorCal SCI, which stands for Spinal Cord Injury, NorCal SCI. And they have on their website a variety of different kinds of durable medical equipment that they take donations in, as well as make those items available free of charge to people in the community if they don't have insurance to cover the cost of purchasing those items. So that's an option for durable medical equipment. My agency, Silicon Valley Independent Living Center, we have the Device Lending and Demonstration Center, or I call our loan closet for short, which is over 250 assistive technology or ability tools that we can loan out to people to try out and see if it's something that can benefit them to increase their independence either at home or at work or in the community. And those could include items like reachers or grabbers, which I just mentioned, to reach something that's down low or up above. It could be the jar grip opener that Susan had a slide on for somebody who has arthritis or limited hand grasp. It could be a pocket talker for somebody who's hard of hearing, which is a little tiny device that you can, either put in your pocket and then has a earbud essentially that, and the pocket talker device has a microphone built into it. And so that amplifies the sound of another person talking to them into their earpiece. And it's a wonderful, fairly inexpensive device that a lot of people find very, very helpful who are losing their hearing and having a conversation with somebody. I love a story. Years ago, there was a couple that, older couple that we were working with, and they were complaining that, they'd sit on the couch and they were, watching a TV program, and one would, maybe make a comment to the other person about something they were watching, their spouse, and they couldn't hear each other, and they they were getting into fights. They were getting frustrated because they couldn't actually have a conversation. And our assistive technology coordinator set them up with these pocket talkers, and they just thought that was the best thing since sliced bread, that they could actually have a conversation with each other about what was important, or even just about the program that they were watching. And those devices run just around $100. They're not that expensive. It could be a mini magnifier, a magnifying sheet that you put over a magazine or a book to magnify the print. Mini magnifiers are a little bit more costly device, but it's like a small CCTV that you can put, again, over the item you want to read. And not only does it magnify it, but also you can adjust the contrast. As Susan was talking about earlier, sometimes people find it's easier to read, instead of black letters on a white background, it could be white letters on a black background, or yellow letters on a blue background. So different kinds of contrast is available with some of the mini magnifiers for someone who has low vision. Also, there's built-up utensil handles, which can be helpful for, again, somebody who has limited grasp in their hands, or has arthritis and can't hold on to small items, like even just a fork for eating It's a built-up handle that can be put over the fork, or you can buy the fork that already has a built-up handle. So that's something that would help with eating. It also could be a built-up handle for a hairbrush or a toothbrush to help them, again, maintain their independence with their self-care. There's a whole bunch of gardening tools that have built-up handles that are easier for folks with arthritis to be able to maintain their interest and ability to do gardening. So that's another assistive technology item. Other items could include a computer mouse device that is a roller ball or a stick style as opposed to the grip style of the standard mouse device. So lots of different options there for somebody, again, who has limited ability to grasp something. And then lastly, is another example, are mobile phones or tablets with simplified home screens and easy to see and read and understand icons, or have large print. So that's helpful for a lot of older adults who would like to be able to use a smartphone, but find maybe some of the standard smartphones very complicated and difficult to use, to understand, or to see the features on. And then lastly, the IQ down there, that is low-cost vision testing and corrective lenses site. So people who need something that's very low cost for a pair of glasses or vision testing can utilize the sources available through the IQ website. Okay, and then the next slide is just our contact information for both Susan and myself. And I think we're going to open it up the last 10 minutes or so for Q&A.
So Sherry, there was a question. I'm going to let you take this one because it's a housing one.
Sure.
And those are always challenging. But Anna was wondering about getting emergency or priority access to Section 8 based on age or disability. So I thought you might want to, you can take that.
Yeah, so right now there is not a priority access for folks that are older to have Section 8 available to them. Our coordinated care system through the county in the homeless prevention system is not set up with that kind of priority. However, there are discussions that we are having right now, I mean, over the last couple of months, talking about this, is that folks perhaps who are quite aged, maybe over the age of 80, should be given priority. Folks that maybe have a terminal illness and are homeless maybe should be given a priority. So we're having those conversations now at the county level to kind of, talk about, are there areas that should be considered for priority access to the Section 8 certificates? Because there's so few, there's not nearly enough of what we need to cover folks that are homeless, or quite frankly, folks that are in institutional care and are in nursing homes and want to be able to move out in the community and should be able to and don't need to be there. There's not enough to cover all of the needs. So so we are having those conversations now with the county and taking a look at that. But right now there is not. It's pretty much you go into the queue, and it's based upon scoring through the VSPDAT tool that is used.
The next question is there a plan or discussion on expanding senior apartment complexes? It appears that the wait list can be 1 to several years.
Yeah, so yeah, thank you for asking about that. So one of the benefits from certainly the Measure A funding that was passed a number of years ago, plus the fact that we do have several nonprofit housing developers in our community that are interested in providing low cost housing for families as well as older adults and people with disabilities is that we're building a lot more housing complexes in Santa Clara County. Excuse me, with the Measure A funding, there's a certain portion that are typically set aside for older adults or persons with disabilities who are homeless to have priority for those, but it's typically not 100% of the units. Most of the time, it's say a complex has maybe 100 units, maybe some of like maybe 25 are set aside under the Measure A funding, and the rest are at various levels of area median income. So there could be, somebody at 30%, 50%, and then 80% can apply into those housing complexes. So we're in the process right now of building many, many, many more housing complexes. Is it meeting all the needs? No, unfortunately, but it is definitely helping a lot in this area for older adults to be able to find more affordable housing that also has a lot of supports and services for them available. The long-term service supports to help them, again, stay safely in their homes and remain as active and independent as possible.
And I think we've made some great strides in the county for building more affordable housing, but we still have a long way to go.
Yeah.
And for not just for older adults, but for everybody. And Angela asked the question about somebody having a difficulty making ends meet when it comes to housing. And it's such a difficult situation, and I don't know if you have some insights into that, Sherry. I think it depends on the organizations that they're linked with also.
Yeah, one of the things that this has been a growing issue, and certainly we're seeing it because we provide direct housing services for the community, and we have a couple of contracts to assist again with homeless folks who have disabilities, including older adults that have chronic health conditions, to help them get more permanently housed. And even folks that have housing, they're being priced out. I mean, Social Security is not rising at the rate of the cost of rent, and it's becoming more and more of a problem. For that reason, some of us are very involved on an advocacy level with the state in trying to get rent subsidies to be implemented for folks that maybe they just need an extra $100 or $200 a month in order to stay housed, or in order to qualify for housing to get into. So there's actually, unfortunately, there was a bill last year, it didn't pass, but it's being brought up again. It's AB 37. That's something you probably want to follow and even chime in on and support. Let your assembly members know and your senators know that you support something like this, but it is a rent subsidy pilot project that we're trying to get the state to start. There's only one city that I know of in California that has its own set aside of rent subsidy pilot, excuse me, and that's San Diego. But there's some conversations that we've been having also with the county to take a look at on the county level and seeing if we can establish some type of rent subsidy program. We all certainly saw during the pandemic the important need for the rent subsidies that were available, but they've all disappeared. However, the need hasn't. So we need to continue those efforts. Thank you for asking that question.
And there's more resources coming in through the chat. Laura Anderson just shared the Office of Supportive Housing link, which is a great place to resource access housing resource information.
Great, thank you, Lori. And then I saw there was a question here about the Able People Foundation. I think I had that same problem too recently. I think they might have just aligned with NorCal SCI. So I'm going to put NorCal URL in the in the chat there for you, because they're the ones that have the durable medical equipment now that is available for loan.
And it looks like we only have 1 minute left. So time flies when you're having fun. Just want to say thank you so much to Sherry and Susan for taking the time to provide this training. We're really thankful, and thank you so much to everyone for attending as well. I know everyone here is very busy. So if folks could please fill out that survey, I actually put the correct link this time. It would be really helpful. And like I said, we're going to be sending out the slides as well as the training recording to folks. And so you'll have access to all this information, all the links. And if you do have any questions, please feel free to reach out to me. I'm going to put my email in the chat. And if you have any questions that you'd like for me to send over to Sherry and Susan, I can facilitate that communication. And I'm happy to do that.
Thank you, Carla, and thank you for inviting us back. We really appreciate the opportunity to share this information with everyone, and it was a great interactive, loved everybody's response.